Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes...
The following views are those of the host and not those of Clear Channel Broadcasting licenses.
Have you gone to the doctor recently because of pain throughout your body for which there seems to be no relief? Introducing Dr. Anthony Pinozzo. The Dr. Pinozzo Sports and Medicine Hour will bring you a new technique to resolve painful issues throughout the body. Dr. Pinozzo has worked with over 65,000 patients over 40 years and has developed a revolutionary approach to pain treatment. His treatment allows fast and effective treatment of pain without narcotics, surgery, and physical therapy. There is no manipulation or alternative approaches. Weight bearing and the return of normal range of motion without pain is the best kept secret this man has to deliver. So, get ready to call in and ask all of your painful questions and get the answers you've been looking for. Now, here's today's edition of Dr. Pinozzo's Sports and Medicine Hour.
Good morning, everybody, and welcome to another exciting show with Dr. Anthony Pinozzo. Doc, how you feeling today?
Terrific.
And also, I want to say hello to our esteemed producer, Freddie Santori. Freddie, how you doing today?
Good morning.
And the lady on the board, which we're always happy to have, Linda here. Hi, Linda, how you doing?
How you doing?
Before I do anything, I want to say something to everybody. If you don't remember any number, if you don't remember your kid's birthday, your wife's birthday, your birthday, remember this number, 561-381-5800, because this number will find the source of your pain and fix it. No surgery ever needed and no drugs ever needed. That's what happens when you call Dr. Anthony Pinozzo.
I know that number.
You know that number? That's a pretty good number, Doc, right?
That's my number.
You know, today we're going to do some stuff that's a little bit more exciting. Doc, one of the things that I happen to research, well, I think we have a call already. Is that possible, Doc? Hold on a second. Let's see what's going on. Hello? Well, I guess not. I guess they're just having a little fun with me here. Okay, so let me get rid of that one. Okay. Doc, something I want to ask you about. Did you know, I was reading on the internet and I was reading in the Journal for the American Health that over 600,000, you hear this, folks? Over 600,000 back surgeries are performed each year. Is that amazing to have that many surgeries?
Yeah.
Why? Why?
That is the standard that comes out of the research in the medical schools. That's what they're taught. So that's how they approach it. If you go to a surgeon, you're going to get
Doc,
surgery.
you got to hold it. Someone's already calling you. Zach. I can't help it. Zach wants to talk to the doctor, so I got to give Zach a chance to talk to the doctor. Hello, Zach? How you doing, Zach?
Hello?
Hey, Zach, how you doing? No, I guess Zach didn't want to wait. I'm sorry, Doc. Go ahead.
So that is the standard. Now, as research progresses and they could treat those things without surgery, then you'll have a decrease. But right now, they're not taught enough in a medical school to evaluate these patients properly. And I know I wasn't, and things haven't changed. But in my specialty, this is what we do. We do treatments between the therapy and the surgeon.
Mm-hmm.
And it is mainly effective. So that you have to remember also that when you go to therapy, chiropractic, acupuncture, and all that, your care is being dropped because the diagnosis is not secure. So they're just doing the best they can, and I'm sure they're honest about it. But what I'm talking about is philosophical. You have to approach it in the right manner. Now, MRIs are the standard now.
Yeah, talk to me about MRIs.
And years ago, the standard was laying down X-ray of the lower back, and then they tried to figure out what it was.
Mm-hmm.
Then it came MRI, and the expert then became the radiologist. So you see what's happened. The surgeon is doing what the radiologist suggests they do, which is not right. I wouldn't do that. I do my own work.
So,
and so
we
developed we developed a philosophy where and this came out of AT&T. I had a friend who worked at AT&T, and they had a commitment training program. So I said, you know what? If I get the patient to commit to a pain pattern, then I can commit to treating it. And so that's what we do. You can't get treated in my office unless you have a pain pattern to treat.
Explain
And-
what that is, a pain pattern.
Well, it's I'm hurting here, and then I go down my leg. That's a pain pattern.
Okay.
That tells me where it's from. But if you don't have that on the exam, we don't have a basis to treat. See, so I'll say, well, I don't have anything to treat. When you bring to get the pain, just come in. But the exam is a standard that we use as a basis for the next treatments. So that what we do is we do a treatment, then we re-examine.
Mm-hmm.
If that pain is not there in that place, then that's going to be a cure in a couple of days.
Wow, that's amazing. So when someone goes in for an MRI, that was ordered by the doctor because the doctor really didn't know where the pain was.
Right. The doctor doesn't know where the pain
Okay.
is. So he goes for an MRI.
Okay.
The guy who reads it doesn't know where the pain is. He's just reading it.
Okay.
And the guy who reads it after that doesn't know where the thing is either. So they're saying, well, the first doctor says, well, I don't know where this pain is. The radiologist says, well, you got this and this and this. And the surgeon who's reading that says, oh, he's suggesting that you have this, so we'll operate that. That's the way it goes.
If anyone wants to talk to the doctor online today, he'd be more than happy to answer any of your questions at 877-927-6969. So, Doc, what you're saying is so unbelievable because in that same article, ready for this? Everyone, I want you to listen to this. Out of the 600,000 back surgeries that were performed in this country alone, 90% were unnecessary. And this was quoted in a very prestigious magazine. You go on the internet and you can look it up.
Well, if you have a cancer or something, then it's justified.
Mm-hmm.
But if it's just for pain, it is not.
Really?
I'm adamant about it
Well, yeah.
because we get a 100% cure rate. I mean, you can't leave the
Wait,
office.
say that again now. What?
100%
cure rate.
You can't leave the office with the same pain you walked in with. I'll make you wait. We'll look at it again, but
Yeah.
you're going to be satisfied. That should be the standard. Dude, that should be the standard.
Hey, Fred, did he ever let you leave when you went in to see the doc?
No, he didn't let me leave until I was no pain.
So when you saw the doctor, how tall were you?
I've grown an inch and a
Oh,
half.
so you want to tell how tall you are?
No, I was supposed to be 5'11", but I wasn't.
No, okay. So
But I'm over 5'11" now.
No, this is true. Once we straighten up your pain problem, you do grow.
It's true, and he kept saying to
And
me,
you
"You're getting taller."
I know, I see it too when I.
People, especially ladies, they always complain, I lost 2 inches of height. I said, you didn't really. You're just curved here. That's all. When this curve comes out, you're going to be tall again. See, the whole thing is just misread. I mean, it's just.
I
That's
think
why
that
we're doing this program, Freddie.
No,
This
I
is
understand.
educational.
Right.
Oh, no, absolutely, and it worked for me. I think the problem is that it's such a simple explanation, and everybody's so used to getting complicated,
Right.
and taking pills and medication,
Ah,
and all of a sudden you have a simple solution to a problem. You're taking away pain, and people just find this can't be real.
That's the thing that we're trying to let people know. That I always say to people, let your second opinion be your first. Go see Dr. Pinozzo.
That's good advice.
I mean, how could you go wrong? And here, just what you were talking about, Freddie and Dr. Pinozzo, according to a recent article, which I won't tell you, but you go look it up on the internet to show that we're not making up stories. 63% who go for back and neck surgery have to come back again for a second surgery. What does that prove, Doc? Why?
well, the whole concept is not right. You shouldn't have to have another surgery. But what happens is once they fuse an area, the movable parts take more of the usage. You remember the design of the spine. It's got many, many bones, and they all do a little bit. That's what gives you the flexibility. Now, when you take that away by a fusion, and they have anterior fusions and they have screws, they do screws now on the back. But once you get that, then you're using structures that are overused. They become painful.
Wow.
And so what we do is we just eliminate that by. Well, one thing that people always ask me, you said, well, what do you do? They ask me over the phone, what do you do?
Yes, explain that.
You can't ask a question like that. You can only ask it after you get examined because we don't know what you have over the phone. This is not a cookie cutter operation here. This is individualized for everybody who comes in.
Now, you read your own x-rays.
I read my own
And you take your own x-rays?
I take my own x-rays.
Why?
Because I know they'll be accurate.
Okay. So you...
Well, I have a question.
Go ahead.
You use the word operations. How complicated is a simple operation? A knee operation, an ankle? I mean, isn't there infection? All sorts of things can go wrong. You snip an artery.
Yeah, you can do all of that. Yeah.
I mean, you can go in for a simple operation and not come out alive, correct?
That's right. Yeah.
So no operation is simple. So people rather take operations, pay a lot of money, risk infection or something else worse, than to get a
Well,
simple
it's
resolution.
not only the money, because it's usually paid by an insurance company, but what it is was it necessary?
That's the other thing.
Yeah. Wasn't
The
necessary.
money has no meaning. It's if it's necessary or not.
Well, let me just stop you on that. Well, since we brought up the Washington Post pretty prestigious newspaper, they said too many back surgeries are performed, and how many of them were really needed?
I don't think any of them.
Huh? Okay, so there's an answer now. You know what I think is happening, Freddie and Dr. Pinoza? You're ahead of the curve.
Way ahead. No,
Especially the way the medical system is
Yeah.
working right now. I mean, Obamacare is asking doctors to make less, give the same services, if not better.
actually, when you this is good for me.
Exactly.
There's always a benefit and a downside to these things, but we can fix a back for X number of dollars, and it doesn't come back. So you have one charge, and that's all you get. You don't have to pay, keep paying, keep paying.
And and there's no surgery involved with Dr. Pinoza, and there's no meds. I mean,
Right.
a lot of these people are on heavy doses of medication after back surgery. They're in a lot of pain.
Actually, there's no exercise and nothing.
Yeah.
we
You don't
just
have to
take the
exercise.
pain away. That's all.
Well, I brought in a friend of mine who was a weightlifter, world class, and you treated him. He had a motorcycle accident, and they were going to amputate his legs. Remember him?
Yeah, oh, God. Yeah,
Well,
certainly.
me and Linda were at the bank the other day, and we saw him. Doc, he's lost tremendous amounts of weight. He's off the meds, and the meds that they gave him he became addicted.
Oh, yeah.
That's the other side to the quarter here. You take medicines for pain, you become addicted, then you have a new problem.
You do.
And this guy's gone back into the gym. He's not lifting like he used to because
No.
he's not competing
He's
anymore.
doing cardio now, which he couldn't do before.
Exactly.
I guess we saw him.
Yeah, you took care of
You
him.
didn't
Took care
mention
of him twice.
Yeah, and the remarkable thing is that he says he got his life back because now he's able to take his son to the beach. He's able to spend time with his wife. He's not doing drugs and hiding in a room, depressed.
We're gonna post that how he looked when he came out on Pinozo.tv so people can actually see this guy. Here's a guy that must have been, what, 250 pounds, was crying?
Yes.
I mean, is that amazing?
Well, it wasn't the weight that was painful. You see, that's another misread.
About weight bearing, right?
Weight that you're on your body does not cause pain. Remember, when you have a pain, it's one spot. How could weight affect only one place and not the other? It doesn't track. So weight is not the issue.
Sounds logical.
Engineering, how the design and function of if we're talking about a spine, how was it designed? What happened to it? That's how you approach this. Not with an MRI or manipulation or anything like that. You don't do it that way. You figure out on an engineering basis, design and function. Remember, design and function. Pain pattern, reproduction of pain, elimination of it, and retry of the exam. So if you don't have the pain on the retry of the exam, then the whole concept is correct. It's another dimension, not an MRI. This is engineering, design and function.
Well, this show is actually done so people could get educated. You know, Dr. Pinoza wants to educate the people on what's out there. And it's like Freddie and I were talking about over at lunch one day. This is so unique. People, for some reason, don't think that this man could prevent you from back surgery. And he can.
And we're going up against a lot of bad information, the history of medicine. And it's not bad information. It's what they learn, you know, how to take care of the pain.
It's a very conservative group. And once the professor says something, you better do what he says or else. Then you got the liability. You don't do what the professor said, the lawyers will kill you.
That's right.
It's the wrong thing. Hey, what are you going to do? That's the system. So
Now, how many years have you been doing this now?
I can't count that high.
But the bottom line is, if you've run in,
Over 40 years, we could say that.
Boy, it's over 45 years.
and you've run across the medical profession, saying that what you're doing
I've been
doesn't
subject to it.
work, and you've passed every test.
Yeah, I did, yeah.
How about those chiropractors? I mean, come on, guys.
They're a mean bunch, let me tell you.
Let me just tell you this. I don't want anyone. Freddie, Doc, let me ask you a question. When that guy comes and he grabs your neck and he twists it and he says, "Okay, I have now cured your cold." Come on.
Well, I've never gone to a chiropractor.
I've watched these guys. How do they? I mean, when
I've
they
never gone to a chiropractor.
when they crack the back, can't that? I mean,
The problem with manipulation is they can't manipulate one spot.
Right.
There's no way to do it. Once you crack, you are injuring yourself. That crack means a ligament stretch, bang, which means the next day you're going to have a pain right there.
so we don't.
So
like
that's
those.
why you can't get better doing that. I studied all this stuff. Let me tell you, I did manipulation a couple of times. And I figured it out. You know what? This is not going to do it.
Mm-hmm.
And so we stopped doing that. Now they're trying to sell stretch, computerized traction.
Wow.
I've been doing traction since 1968. It's not the greatest thing there is. You don't cure anybody with that. So we had an experience with that, as
Yes.
Les knows.
I'm going to give you the latest that I heard. We produce other shows, other stations, and what have you. One of the things that we heard when we were doing our job was that they're selling pills from squid oil, to take away inflammation
Oh, my God.
from the body.
The other thing I want to know, do you know what is emu oil?
No,
I thought emu was a bird.
isn't that?
An emu is a bird.
Yeah, well, they sell emu oil.
They're putting all sorts of oil. But the unique thing about this pill was that it was supposed to take away inflammation.
Yeah.
So they were acknowledging the fact that inflammation is causing the pain.
Right.
Right.
Exactly.
Which is what you've been saying for years.
Right,
But
right.
the way they're going about to treat it is they're rubbing some oil or giving you a pill.
The thing about it is it can't get through the skin. There's a barrier there.
So they give
The
you a
blood
pill.
takes it away. If it goes through the skin, your blood is taking it away as fast as it can. It doesn't get to where the problem actually is.
Well, that's what I've always admired about what you do. It's how you do it. See, the secret here is everybody can get the medicine, but it's how you administrate it. It's how you
Source
were
of the
able to
pain.
use your hands to find a pain I had in my shoulder. I mean, you touched me and I saw stars,
Right.
but you were able to do it just with your eyes and your hands.
Yeah, correct. Yeah.
And that's the difference right there.
Yeah.
That's the difference. It's application, pinpoint application.
Well, that shoulder exam is unique to us. I went back to the anatomy and figured out how the thing is supposed to work. It's not muscles, it's not tendons, it's ligaments. And then I developed an examination for it. And you were subject to that. So I did this, and I said, "Here's your pain." And you said, "Oh."
It hurt.
I know.
But I'm gonna tell you,
I was there.
I was leading up for weeks. I mean, I've had this shoulder pain for weeks. And I thought it was on the top and the back. And Linda will tell you.
Yeah.
And we put oil, we put electrolytic, whatever that thing is. I wanted to see if you could locate it. And I thought that it was up and behind me. And when I came into the studio and you put your thumb right where it was, I mean, it was amazing. I was in the wrong spot. It's my body.
Yeah, that's
So
right.
if I'm in the wrong spot,
that's
how many
true.
people are in the same position thinking as this and it's really somewhere else?
Well, I mean,
That's
for
true.
over 46 years, the man has cured almost 72,000 patients. We got to change that commercial. It's up to 72 plus now. I mean, Freddie, in a couple of weeks, we're going to have a very well-known talent from this station is going to join Dr. Pinoza. I could give her name, Leah, and she came in with a problem that she thought was a foot problem. She actually was going to the chiropractor to get those shots in the leg and this and that. Guess what?
Podiatrist.
And guess what? It wasn't an ankle problem. He just by her walking, you were able to determine that it wasn't the ankle.
Well, it's amazing what you do. I mean, I learn every time something I see, I learn something else.
Well,
Lady with the scoliosis from England. I have the videos, ladies and gentlemen. I will be posting it this week
on Pinozo.tv.
on Pinozo.tv.
That is amazing. She lost half of her curvature in 1 week.
The funny thing is, Les, I asked the doctor if he changed the pictures on me. I couldn't believe it was the same person, and he went through them and showed me.
It's amazing.
And the curvature went from a hook to practically being straight.
Yeah,
And she was at the biggest hospital in England, one of the most, and they said nothing we could do.
Nothing we could do. And she's going to go back and show them. She wants them to take an X-ray, which is the amazing thing.
Oh, man.
I've never seen anything like that.
How does that make you feel? You know, does it make you feel good when we're doing a show like this, and we could honestly tell people out there that we have documented proof? I mean, why go if you're going to go in for back surgery, folks? If you're going in for neck surgery, if you're going in for any surgery, why don't you just give Dr. Pinozzo a call off the air at 12 o'clock at 561 381-5800. I mean, this will be probably one of the best calls you'll ever make. If you want to talk to Dr. Pinozzo today, you want to send in a tweet or a text or anything, you can call him at 877-927-6969. We're going to take our first break, and Dr. Pinozzo will be back right after the break. Thank you so much.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world, but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. You're listening to Dr. Pinozzo's Sports and Medicine Hour with Dr. Anthony Pinozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pinozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pinozzo's Sports and Medicine Hour.
We are back with Dr. Pinozzo and Freddie. Freddie, who's got like 9 jobs here today, running the show and taking the tweets. So you just got a tweet from somebody, Freddie?
Yeah, I got one from from Larry in West Palm Beach asking, he's going in for surgery for a bad meniscus. And he's asking, so coming to see you, I have alternative?
I don't believe that a meniscus should be operated at all, because the pain of the meniscus is not in the meniscus. It's in the periphery of the bone. It holds the joint together. That's where the pain is. It's not in the disc. So, and if you do that, and they take that cartilage out, you're going to have a steady deterioration of the function of that knee. Scar tissue will be rampant. And then when you're 20 years down, they want to replace the knee. Don't even do it. Here, let me show you. This is a real, this picture come out of my medical book. This is what we studied. Mm-hmm. All I did was color it.
Coding the lines, though, right? Okay.
Frustrated 6-year-old is what I am. Well, anyway, the...
Describe it because we're on the radio.
Right here, this is the meniscus right there.
Describe what you're showing.
Well, before we do it, we have a call. Never mind. Go ahead. I'm sorry, Doc. A call came in.
This is the knee, and I got to get it on the camera here.
There we go. I can see it now.
Okay. See, it's backwards. I got to figure right here. This
okay,
is the
Doc, but
meniscus.
you're on the radio. Describe what you were looking at.
Oh, that's right. Yeah. This is the picture of the knee.
You're the doctor. You know this by heart. The other people don't.
On the radio, they can't see it. They got to go to Pinozzo.tv.
Yeah. Right.
All right. What you got to know is that there is no pain fibers within the knee. You hear that right? None in the knee. They're all on the periphery. It's a ligament structure that holds the bones together. So you got a femur and a tibia. It has to be held together, and it has to be flexible enough so it can perform its function, which is walking or running or bending. All of those things happen because the ligament structure is on the outside, not the inside. So ACL is not affected. Cartilage is not affected. What else is there? That's it. So it's all on the periphery. Now, how we approach the meniscus, so-called, is it's a ligament. So all we do is inject it with a steroid, and it goes right out.
And talk to me about that steroid. It goes
One day. I mean, it's one day.
and it's out of your system. You don't have to worry about anything.
Well, what we use is short acting, which,
Okay.
which I like for myself. It's only I use this on myself.
And I've been there when your son flew down to give you pains for.
Yeah.
Yeah. So and your back is fine now, right?
Even me, I get sick. Then.
Yeah, we all do, right?
Doc,
So-
I got a question.
Go ahead.
Professional athletes, do they have to worry about the significance of
Steroid?
using this medicine in their body?
No, it is entirely anti-inflammatory. It has no protein or muscle building qualities at all, and it's short acting. It's like 9 hours, and it's out of your body. There is no way you can get. There's no downside to what I do at all.
Guaranteed.
Guaranteed that.
The reason I ask is because
But when you talk about an athlete, you know, who do they have there? They have a surgeon and they have a trainer. There is nobody in between like me to
right.
help them out. And does the trainer know everything? I would say no.
Well,
The surgeon doesn't know what I do. I don't know what he does either.
Well, I just found out that the NFL, you can be an independent. It is approved by both the Players Union and the NFL. And if your medicine passes certain tests, they can put you on the list to call. So that's the next thing we're going to be working on.
Yeah, we should give them an opportunity. Every athlete I've seen has done very well.
That's amazing.
Look at Peyton Manning. Could you imagine what's going to happen now? They're checking him out now to see if he can play. He might not
that's
play
a-
this season.
That is a tragedy
Yeah.
right there. What a talent. And what happened to him? He went somewhere and they just fused his neck. Well, you can't play football when you can't move your neck. You have to be able to turn. And when you have a fusion, you don't turn.
You watch it. Well, he's right. You never saw him go like this with his head back and forth. He was moving his body as he was releasing the ball.
Well, he's also 40 years old.
Yeah.
Well, that has nothing to do with the age. Has nothing to do with the pain. You have to be quick to move your head to see the player.
Mm-hmm.
Now, if you're fused, you're moving your body to see it. Which
That's what he did last year.
Which takes longer. And now you've lost your credibility with that player who's supposed to catch that.
I didn't even read it. Is he in a lot of pain?
Well, they're going to.
He's got to be, because you can't have that kind of stuff without having a pain. There's no way to do it.
They're going to be evaluating him and see whether or not the doctor's going to let him play this year.
They ought to let him come and see me, because I could take that pain out that he
So
has.
Peyton, if you happen to be listening and you want to know what to go, or how about any of you guys on the Miami Heat or the Miami Dolphins? You know, call this guy. I mean, let's face it. It doesn't pay. It doesn't. How is it going to hurt to call this guy?
Well, the
This
bottom
man is
line-
amazing. I mean, no one understands what he does.
We gotta contact the NFL and let
Right.
them know what you do. And then once they give you the thumbs up, the Players Union has to give you the thumbs up. Then you become an independent, and that's the only way you can take stuff not on the list.
Right, and we only want to help the players. I mean, I enjoy a good game, and I hate it when people are sitting down on the bench. I remember one year that all 3 stars for the Heat were on the bench.
Yep.
3 weeks. And then, I got to tell you about this copper. What is that? Copper something. or
Oh, the
other.
copper bracelets that
Their
they wear.
sleeves.
Yeah,
That
what's
is,
that all about?
that is so stupid. That's dumb. I mean, compressing the muscle is going to do anything for you? No. Absolutely not. And the commercials are so slick. You can't believe it.
Well, what do they offer? Compression ice. For
Well, it's
relieving
not even
pain.
ice. It's just compression. You have to buy that
No,
sleeve.
but in the NFL and when I played,
Oh, yeah.
they used to compress this, put it in ice, compress this. What does that do?
Well, they used to do Whirlpool. That was the
Yeah.
big thing.
Right.
I don't know if
I
they
hated
still
the
do that.
Whirlpool.
But,
Oh, yeah.
I took Whirlpool baths. Oh my God, it was horrible.
yeah.
It doesn't work.
No, it doesn't.
It numbs you.
Yeah.
How can you not feel anything?
Nothing works except the proper diagnosis. And I always tell people, look, if you don't get better in 2 weeks, you're in the wrong office.
Yeah, that's good.
I obviously don't know what I'm doing.
Well, that hasn't happened yet. We know that.
Yeah.
Well, it's amazing because Linda Harmon took me to do a show yesterday, and I saw the nurses walking in to get massage therapy
Oh.
because they're on their feet 10, 12 hours, 14 hours a day. And all this inflammation, and they look like Dick Butkus from the waist down. You know? I mean, there's nothing but inflammation, and it's huge. And they had, on call, they have somebody hired to massage people who are on their feet 14 hours a day.
It's amazing, Freddie.
All I'm saying is give this a chance.
Think about massage therapists, is they think that they know everything.
Oh,
I mean, you talk to them and they could do this. They can't do any of that. Why, Freddie? Why? Because you need a diagnosis first. You can't just treat. You have to know why it's there, where it is, why it is, and
they
they're
come back every week, Doc.
They're treating
Yeah.
back pain, and they're making a lot of money. And where is their credibility? This is what I want to know about the medical profession and the ancillary personnel we're talking about. Where is the credibility of these people? If they don't improve somebody right away, they ought to refer it off, not treat people for a year.
And here's what I want people to know, Frey. Where'd you go to school, Doc?
Ohio State.
Graduated with an MD.
Yep.
Okay, so I'll tell you something. I went for a massage 3 years ago. I'll never go back again. She gave me that deep tissue massage. I couldn't move my neck for 2 days. So I haven't gone for a massage since that, for that reason.
You see, it's not the muscle that hurts.
No.
That's what they're treating. So the whole thing is really bizarre. I mean,
Well, you know, people were walking out of there psychologically thinking that they were
Yeah,
cured,
psychologically, right.
well,
Psychologically.
they like that hands-on, you
Yeah.
know.
Yeah.
I think massage should be done. And it should be done with low lights, glass of wine, and a partner. That's how you do massage.
You know, Doc, that's what okay, now we're on the page, guys. I agree.
That ain't what we're selling today, Doc.
We're not selling out today, Doc. They can kick us off the air. You know, here's what a lot of people don't understand, Freddie, and I think it's, this man has not only gone through medical school, he's not only gone through college, he's not only gone through
Well, I had residency,
and
too.
residency too. I mean, we're talking about a real doctor.
He's an MD.
And how come you're the only one that does this?
Well, because I approach it in a different manner.
Okay.
I was not successful doing what ordinarily is done. And this was like 68.
Right.
I was a heretic because they thought, what is this guy doing? He has an office and they blaze on hot packs. No, we never did a hot pack in my life, ever, because it doesn't work. So anyway, we got on the concept of weight bearing. How does the body bear weight? What does it have to do to function? I mean, look at an athlete who does the flips and all that. Well, there's a way to do that. It's designed for that. So what happens when you can't do that? So now you have a problem. And then I developed the concept of what is a pain anyway?
Amazing.
What is a pain? Not structural. It's inability to stretch. That's what it is. So when you have a bad elbow, you can't put it out. Why? You can't stretch it. And that means that there's a structure in there that doesn't allow the normal function. So that's how you approach it. See, it's all logical thinking. It's all taking the anatomy and the physiology into aspects, and then the figure out design and function. That is, I think, the key.
Design
Design and
function.
function.
And you take insurance, which is amazing, right?
We take any insurance that'll pay me.
Okay. Well, we're not going to say the one we know that doesn't pay you, but the good ones,
Well,
the
you
big
got
ones.
the HMOs. If you're not on an HMO, just think of that. An HMO says that you can't get treated by the best there is. How cruel is that an HMO would do that to the client who's paying them? It's cruelty. It's a misuse of power. It's wrong.
Yeah, because they want you to buy the other policy, which allows you to go to any doctor you want, and that's a lot more money.
The management is not correct. This
No.
is all management. They produce these things, and they say, well, we got this doctor, we'll close the panel. But those aren't the best ones you can get. There is no best one you can get. They're all there. People change. People develop. People learn things. The next guy is the best one, not in that panel.
Mm-hmm.
And I'm looking back my shoulder. Who's going to be better than me? You know?
That's a good point.
Well, the only one that's going to be better than you is Paul, because Paul is younger, and
Oh,
he's
yeah.
your son, and only two of them do this procedure, and it's amazing. I mean, I have someone sitting right here that, since I know him, he's been in pain.
Well, we communicate every day.
Yeah, and that's great. So, you know, the
And,
young...
so we talk about these things, and we do research. We did it on migraine. He's 2,000 miles away, and I said, this is my concept. Can you try it out for me? And he did. He said, he called me back a week later. He said, that works.
we had...
Now, what I'm talking about works. I'm not talking about long-term treatment. I'm talking about 2 minutes. 2 minutes, that pain is gone.
Well, talk to us about the guy that came in.
So I went to the medical school down in Boca, and I called the professor of anatomy, and I said, I want to dissect the neck, because I'm doing research on migraine. So he met me. 2 hours we went to these bodies, and I could see where the structure is.
Wow.
And
Wow,
so I
wow,
went back to the office, and I developed a treatment for them based on the anatomy, design, and function. And then I called Paul, and I said, try this out. And he tried it out. He called me back, said it works.
Well, we know it works. Tell us. I was in your office one day, just kind of seeing what we're going to talk about, and a gentleman, maybe in his late 20s, came in.
28 years old.
28 years old with his mother, because the mother had to drive. He had severe migraines.
Right.
He was taking all kinds of medicines. He's gone to every single doctor, and I'm going to ask him to give a little testimonial. What happened?
Well, he had two problems, actually, migraine and a TMJ.
Okay.
They both refer up into the head. And so I, have to separate them out.
Mm-hmm.
And so I said, look, I can get rid of this migraine for you. I gave him one shot, and the pain left in 2 minutes. He couldn't believe it. So he came back a week later, and I did the TMJ for him, and then he's cured. 2 visits, and he's been taking drugs forever.
Oh, what was it? Androl? He was taking this really powerful drug, and he couldn't get rid of it.
We changed his life.
Yeah, you did.
Literally reformed his whole life.
It's amazing. Isn't it?
Doc, I got a question for you. I know that somebody came to see you that had some kind of pain. I don't remember what it was. And he was heavily medicated. He was on a lot of medicine. And you wouldn't see him until he came off his medication. Is that true?
I don't think that's true.
Well, he had some kind of medication that he was hooked on, painkillers, narcotics or something. And
no, we'll treat anybody for anything. We're just not going to prescribe anything. That's
okay.
all. So that was his problem. Most
Using
people complain about me because I don't prescribe any narcotics for them. Oh, Les, you were in the office.
I
one
was
day
there.
When some guy railed off on me. I thought he was going to hit me because I wouldn't prescribe any
No,
narcotics.
he came in. He said, well, how come you don't prescribe any medication? And he said, well, he doesn't,
I
because
said,
he doesn't believe in it.
Well,
so you went in there to get medicine.
Yeah, he came in to get
Well, I told
narcotics.
him that I could fix this,
No.
and he refused. So, see, you got to be honest, ethical, moral, and that's what I try to do. It's a moral life. It's an ethical life, and what I promise you, I do.
We spend a lot of time, Freddie and I, in your office to kind of learn and see the result of patients. And we sometimes look at each other, Freddie and I, and we say, I can't believe this. I mean,
true.
I mean, we sit there and we say, how the heck that, it's so amazing. I'm so glad we do this show. Maybe we could educate those doctors that don't realize that you could actually help someone in a matter of a very short time.
You want to talk? You want to?
I got to meet a 14-year-old that he worked on, and she told me the story, and she said the doctor did not do any injections and no medicine
No.
the first visit.
Right.
And he prescribed some other things to help her, and it helped her. Then she injured her shoulders, and the doc had to go in to fix it. But she's 15 now. And she said to me, everybody in sports should come and see him just to get checked out.
Yeah.
Because it prevents injury.
If he doesn't feel you need a shot, he'll tell you that you don't need a shot.
Let me give you another aspect of that. There is a law that says that you have to accommodate a disability. It does not say that you have to accommodate before you hire them. So that's when you do the exam. So you can examine somebody. This is workman's comp, sports, kids that are going to play football in high school, all of that. You examine them if you know how. And how do we do that? Pain production on the exam. Okay? It's very, very simple. And so you can say who's disabled and who isn't. And so if somebody's going to pay $20 million for a football player, they should know what kind of injuries this guy has
I would
before
think
they
so.
hire him. Isn't that right?
I agree.
I mean, conceptually, it's so simple. You can't believe it, but they don't do it.
We're going to take a break now, Frey. We're going to come back. We're going to talk about running because this is the greatest place in the world to run. We're going to tell you how to get rid of a lot of pain. We will be right back. Thank you so much for listening to the Dr. Pinozzo Show.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP, the number 2.tv. Or call them at 1-866-224-5422. That's 866-224-5422.
Dr. Pinozo is a world leader in helping those who have tried everything to get rid of pain in the body. When surgery or pain medicines aren't working, Dr. Pinozo is here to help. Range of motion increased over 65,000 patients that Dr. Pinozo has helped. And now he's here to help you. Call the show now, 1-877-927-6969, and let him help you get on the road to pain-free health.
We are back, and as promised, we're going to talk about some running problems that people have. Hey, Doc, talk about, everyone complains about the ACL. What's this thing about ACL? Why do they always complain? My ACL hurts, my doctor said my ACL.
I don't know. If you look at the anatomy, how it's designed, the ACL only holds the bones together.
Okay.
There's a AC, which is anterior, goes, and then a posterior goes that way. But all it does is hold the bones together, the femur and the tibia, and allows it to move a little bit. That's all it does. There is no repair for this. I don't understand what they're doing with this ACL business. I just don't get it.
So what's the operation they're doing?
I don't have no idea, since these ligaments are very short and they just cross. It's a cruciate, anterior, posterior cruciate ligaments, and they hold the bones together and allow motion. That's all they do.
Are they operating on the ligaments?
Who the hell knows? Excuse me. I don't know what kind of surgery there is. There is no surgery for that. You don't even need it. You don't even need ACL to function, because the periphery, the ligament structure around it, which I explained before, holds the bones together and allows the flexibility. So the ACL and the posterior CL, the cruciate ligaments, are an added feature that the body produced to hold those bones together. That's all it does.
So the inflammation stops the function of those ligaments?
No, you can't hurt them. The function is on the periphery. That's where the pain
Okay.
is.
What does that mean?
pain. There is no pain in the cruciate ligaments.
Right, it's around it.
It's around the outside of the bone structure, not inside. There is no pain fibers inside the knee. And if you doubt my word, look it up on your anatomy book. Ask somebody.
So in other words, they don't need an operation.
No,
and you could fix that.
There's nothing to fix. You can't hurt it. It's all on the periphery,
Oh, okay.
not on the inside.
Amazing. What about shin splints and Achilles tendonitis that everyone complains about?
Achilles tendonitis, well, the Achilles, you can't hurt that.
Okay.
There's no way to hurt it unless you fall off the Empire State Building.
Well, I don't think you have to worry about that anymore.
There'll be a lot of things.
But if it doesn't cure in a couple of days, then it's from the back. It's a referred pain. So you got to know the anatomy, the physiology, referred pain. You got to know what you're doing when you treat people, and you got to get fast results. You can't over-treat.
And runner's knee. The runners are always complaining about their knees. Runner's knees. My knee
Well,
is
the
killing
knees,
me.
what about the
What the?
ITV?
Yeah. What is that?
Well, all that is the iliotibial band. What that is a muscle on the side of the thigh.
Mm-hmm.
Okay, the trainers think you have to stretch that band. You don't. That is not an issue. The pain is probably, well, you have to know where that pain comes from.
Source of the pain.
It's a referred pain. It comes from the lower back, the side of the hip, and the greater trochanter, which is the big muscle, big bone you feel when you put your hand on your hip.
Okay.
And that's where that muscle starts. So if you can treat it there, you don't need to do any but stretching. The whole thing is bizarre. I mean, I'm trying to straighten some of this out, and it's treatable without a lot of stretching, and then you get back to normal function once you take that pain away.
And what about a lot of runners complain about? Let's see if I pronounce this thing right, Doc. Plantar fasciitis, or
There's no such thing as plantar fasciitis.
Really?
That's all you see on an X-ray. That's what you see.
and that's a heel spur, basically, right?
Yeah, but that doesn't, that is not painful.
Okay.
So the problem is up inside the ankle. We treat those in one day. I mean, you can't believe it. Once I figured that out, and we tried it, you get relief from that the same, in 2 minutes in that office. And I'm not exaggerating. People, I'm telling you, this is all the truth. I don't have to exaggerate.
So why does a podiatrist make you come back 4 times?
Well, because they're surgeons and they don't do this kind of work. Between the surgery and the therapy is where I function. So it's a diagnosis and treatment. No surgery, no therapy needed. We take care of all
And
of it.
no meds.
No meds, absolutely none.
So everybody, if
Except
you...
by shot. I mean,
Oh, well, yeah, I don't consider a
sometimes
shot
people, I don't either, but some people say, well, you said there's no meds and now you want to give me a shot. Well, it's an anti-inflammatory
Right.
and it doesn't work unless it's in the right place. So you want to do that. I mean, it's state of the art.
We're not going to wish it away. It's not like you can say, okay, let me think about it. Okay, you're cured.
No,
We're not
and-
selling oils here.
No.
You
That's-
got to get into the pinpoint area of the spot.
Right. Or any place.
Or any
Shoulder,
place.
hip, knee, ankle, all of it.
But here's the key, everybody. Dr. Pinozzo finds the source of the pain, and no one looks for the source of the pain. I think
Gotta have the source.
that's the problem that a lot of people don't have. He finds it. He found the source of your pain. He
Well,
found
that's what
this-
I was saying.
Yeah.
He found the source on my shoulder, which
Right.
I was amazed. I was looking in the wrong place.
Yeah,
and
it's
and
amazing.
It's my body.
Yeah, well, I guess for over 46 years of studying the body, I think that's something a lot of people don't know. Most doctors today, and I'm not saying they're bad doctors, they don't study
No,
the
they're
anatomy
not-
of the
they're not-
body.
They're
No.
not bad. They're just the approach is what I used to do.
Right.
I don't do that anymore.
You
We do
study
something that's
physiology of
more-
that body.
Yeah, it's more productive the way I do it, and the time is way down. As far as a treatment, the faster you treat people,
Mm-hmm.
the more busy you get.
That's-
And
yeah, I mean, come to his office one day, folks, on a Monday, Wednesday, and Friday, and see what
Good
they
luck
talk
with
about
that.
being busy.
Yeah.
And make sure you bring a little chair with you in a magazine
lunch.
because, yeah,
Bring
he
lunch.
is.
no, we have a wall outside.
Yeah, we have a wall outside. They can sit down with a nice water fountain, right?
Yeah, being in Florida, you can sit outside and wait.
Bring lunch.
Yeah.
No,
Well,
I'm only kidding.
No, I mean, yeah. Well, the reason why, folks, is let's face it. He takes his time with each patient. I mean, it's not a factory. He sees you. He looks at you. And he finds a source of pain before he even gives you a shot. And some people don't even
Well,
get a shot.
I'll tell you a story about that because I was concerned about people waiting too long.
I know.
Sometimes 2 hours. But I try to be very efficient and get everybody done. And I'd say, look, everybody gets exactly what they need. I'm not going to shave any time off. Is that okay with you? They said it's worth it.
Yeah.
Tells you a lot.
It sure is. I stopped traffic at the mall.
I know.
'cause
He
I couldn't
started
believe
dancing
that the thing
around.
was gone.
Well, actually, it wasn't in the mall, Freddie. It was in the middle of the street.
Middle of the street.
What was that story?
When you fixed them.
When you fixed
Oh.
my ankle, I felt my toes again and everything. And I was with Les. We went to lunch, and I stopped all the traffic. And people are tooting their horns, and I'm like, "Be quiet!"
I said, we're going to get arrested, and then he's going to have to go back. He's going to get hit by a car, and then Dr. Pinozzo's going to have to fix that, too.
But I was just amazed. That was just an amazing.
Let's talk about neuropathy.
Yes, that's what he had, neuropathy.
That's what I had.
Good.
Neuropathy.
Everybody has neuropathy. That is not a throwaway diagnosis. It is a specific thing. I'm an electromyographer, and I don't know if you know that.
What, tell us what that is.
What is that?
In my training, I did 3,000 electrodiagnostic tests. 3,000, because that's what we did in there. That's why I picked that program. And what it is, you use a piece of electronic equipment to measure the conduction time of a nerve. Now, when it's below a certain number, then it's a neuropathy. When it's above that, it's normal. So, but what is neuropathy? Neuropathy is not a painful condition. Think about it. It's a dying back of the nerve. So how can that be painful? It isn't. What happens is you lose sensation. The ultimate loss of sensation for that is that you can't walk at night because you can't feel the pavement
Wow.
for your feet
And why at night, Doc?
because you can't feel the feet tell you where you are,
Right.
and if you can't feel them, then you don't know where you are.
Right.
So it's very very simple.
And it sort of takes spots too. It doesn't just all fade away. It's like this area might have less feeling than this.
No,
feeling.
it's a dying back from the toes. It's a very progressive thing that dies back from the toes all the way up to the ankle. It doesn't go much higher than that.
Okay, and how can you help that?
Well, you can't really help it because if it's diabetic, then you have to deal with that. Alcoholics get that.
Diabetic retinopathy.
So I always say, people give me always they say they have neuropathy. I said, are you an alcoholic or a diabetic? Neither one. I said, well, you don't have it then. I mean, what's the numbers show? It's diagnosis. Again, better remember, diagnosis is everything. You have to do a nerve conduction study, and you have to do it properly. And there are doctors that do that. I do that.
Mm-hmm.
And that's where you start. So if the normal numbers are normal, then it's what? Another diagnosis. It's a pain, see? A pain, what is a pain anyway? Inability to stretch. But it could be minor or it could be major. The same structure. Depends on the injury to it.
Well, here's a great tweet that just came in. Ron from Delray Beach said, "I've been told I have arthritic knees, and the only solution to this problem is surgery. Is this true? And can your procedure help me?"
Absolutely. Probably 90% of the knee is normal. And it gets thrown away. I mean, it's a tragic situation. I really don't approve of this.
Mm-hmm.
And because it's not efficient. The problem is treatable because the pain is on the periphery of the knee. I don't know how many times we've said that. It is true. You find out where it's painful. You can treat it various ways, but you don't need a knee replacement for that.
Well, here's someone right around your neighborhood, Doc. So I'm going to give Mike from Delray, Dr. Pinozzo's number, 561-381-5800. Mike says, "Can some serious condition be causing my back pain? If so, which ones? Have they been ruled out, and how can you treat that lower back pain?" That's a lot of stuff in one sentence.
Well, his concept is wrong
Okay.
to begin with. Pain doesn't have to be serious in its cause. Remember, they're very small structures. They're like half-inch high and maybe an inch wide. That's it. And it'll ruin your life. But those are treatable things. And so the question was what?
The question was, he has back pain. He doesn't know which one it is. Have they been ruled out? And how can you treat the lower back pain? You say,
well, we do it by knowing the anatomy and the physiology, pain production, pain patterns. We know all of that. We do by the way, we do a special film, which is an engineering study. And when I explain that to people, they say, engineering study? Yes, it's a weight-bearing issue. Pain doesn't just come, it's a failure to bear weight, which is your body. So that means bending, twisting, whatever you have to do. So the history is specific, so we know where the thing is. And then we have to find out why it is. So then we do the film.
right.
And we explain why it is. We do any correction on that. And then we offer pain relief. So say, well, this is where your pain is. This is what we have to do. Do you agree to it? And usually it's, yes, that's why I came. Okay, we go ahead and do it. And then 2 minutes after that, that pain is gone by re-examination. I mean, it's not, I'm saying it. I mean, it's a re-examination because we know what movements produce the pain. Remember, inability to stretch. And now you can stretch. So what does that tell you? Tells you the location was proper.
Well, here's
Hold on, I got one.
Go ahead.
I got Sarah from Boston.
Okay.
She's been told she has neuropathy. But what she's saying is that she feels a tremendous amount of pressure on her feet.
Yes, well, that's probably a referred pain then, from the foot. It's probably a foot pain.
Okay.
Remember, the dying back of the nerve is what neuropathy is. It is not a pain, and it has to be in the toes working backwards. So that's what it's supposed to be.
The pressure. Pressure on the feet.
Pressure is probably an ankle,
In the ankle.
especially when it's the back. Say
So
the
you
heel,
can help her with...
the heel.
No, she just said the foot.
Oh, the foot. Well, if it's in the heel, definitely not neuropathy,
And if it's in the front?
and it's treatable. And it's in the front, then it could be just there's a joint there called the metatarsal phalangeal joint, which is most of what the pain is in the front of the foot. And some people call that a tumor, and it is not. tumors are very extremely rare, and you don't operate for that either.
Well, let me I think we'll have one more person that called. Ron from Delray. Hey, Ron, let me give you Dr. Pedroso's number. You call him off the air, 561-381-5800. Ron wants to know, he's been told that he has an arthritic knee, and the only solution to this problem is surgery.
We answered that one?
No, that was a different one.
Oh.
It seems that everyone's having knee problems. I have one guy, Mike has knee problems, now Ron has knee problems. Tell him, we know already that's not true.
We know the problem is not within the knee, so don't get it replaced. You get it treated on the periphery.
And you can have them come in and take a look, right, Doc?
Yeah, we just give you a diagnosis. We can't do it over the phone because we don't know what you look like. But if you come in and we examine it, I'll show you what I think it is. I mean, climbing steps is a specific area. It's not even in the knee.
Really?
That's Bob at the radio station. You took care of that problem.
That's right.
And there goes the phone.
I told him to call after he's off
After
the
the show, and they're calling now.
So, I know. It's funny. We get calls on the air as we're sitting here. Well, it's amazing that the gentleman you were telling about. I know there was a fire drill in his building, and he had to sit there because he couldn't walk up and down the stairs.
He had a baseball injury for many years, and they told him. And these were doctors for a Major League Baseball team, and they said he would never walk straight again. And you took care of him. Now he showed me by going up and down 5 flights of stairs that he could do this thing. So I said to him, "So you're a believer?"
That was one treatment.
That was one treatment, and I begged him to go back.
See, a guy like that doesn't really evaluate things properly. I mean, if you can't do this now and you could do it then, I mean, what else do you need?
Well, let me stop. We got Randy on the phone. Hold on. Hey, Randy.
Hey, how you doing?
Say hello to Dr. Pinozo. Let's hear what's going on.
Hey, Mr. Pinoza. Hey, actually, I'm calling in from my father. He's got a disc in his back, a bulging disc in his back, and it's going down to the back of his leg and everything like that. And I'm just wondering if he was misdiagnosed because he's still having that problem like 2 months later. And he's been to like 3 different doctors. And he's actually listening right now, so I was just wondering if that's something that you could help him with.
Yeah. When you go to 5 doctors and they all say the same thing, you can be sure that they're all the same kind of doctor. You don't want to do that. You want to go to somebody who approaches it differently. And we don't do surgery, so we can't hurt you. I mean, we can only give you an opinion.
Right.
But if you go to surgery, it's done. There's nothing you can do about it, and now you have scar tissue. So you had the first problem. Now you got the second problem, and we got to straighten all that out, which we can. But that's the problem with this fellow there. So he can be re-examined, and the way we do it, I'll tell him what he's got, what we can do about it. We're not going to undo the surgery, but we'll just deal with it.
Okay, thank you very much.
You're welcome.
Thanks a lot, Randy.
That's a good example of 5 same doctor's opinion, and they're all wrong. He still has the pain.
They're all the same trained, so that's the way they look at it.
But they're not helping them.
Remember, these are honest people. I mean, they're not out to mess anybody up, but they have to rely on what they're trained to do and what they're allowed to do under the liabilities that we have in this country. It's terrible.
Exactly.
And I'm not subject to that because I'm not trained that way.
Exactly.
Right. So I think that's important what Dr. Pedrosa just said. All these chiropractors and all these orthopedic surgeons, they go to get the same basic training as everyone else. So if you go to 5 doctors, they were trained to say the same 5 things. But you aren't trained that way because the one thing I want everyone to always understand, Dr. Pinozo finds the source of the pain. That is such a key thing, the source of the pain, which to me is no doctor who does that. He finds the source of the pain.
Well, that gentleman went to 5 doctors,
yeah,
and he still has the pain. So obviously something is wrong.
Yeah.
5 times. Not once, not twice.
Not 3 times, 5 times.
And if they only think about the physics of it,
right,
the weight-bearing issue, I mean, it's a whole concept that's not taught in any school. And I should call that the Pinozo's method. I mean,
we should start a school to teach these doctors how they could actually help people.
Well, I thought we'd make an endowment to medical school so we can get the curriculum in, maybe.
Why don't you give the doctor's number so they can blow up his phone?
So everyone who wants to hear the doctor will be off in about 1 minute. 561-381-5800. That's 561-381-5800. And I'm driving today, Doc, so you can take all the calls you want.
Okay. Thanks for listening, people.
Thank you so much for listening to Dr. Pinozzo. If you want to see more stuff about Dr. Pinozzo, go to drpinozzo.tv. Have a great weekend. Freddie, thank you again for everything you've done. Linda and Dr. Pinozzo, goodbye. We'll see you next week. Thank you.
This has been the Dr. Pinozzo Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes with Dr. Pinozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pinozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pinozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.